Structuralism, a foundational school of thought in psychology pioneered by Wilhelm Wundt, sought to understand the underlying structures of consciousness through introspection and experimental methods. Wundt's laboratory in Leipzig served as the epicenter for these investigations, where he conducted experiments aimed at dissecting the components of sensory perception. One of Wundt's notable experiments involved measuring reaction times to sensory stimuli like lights or sounds. Participants were tasked with pressing a button upon becoming aware of perceiving the stimulus. Through meticulous measurement and analysis of these reaction times, Wundt aimed to deconstruct conscious experience into its fundamental elements. By manipulating variables like stimulus intensity or duration, Wundt could observe how these factors influenced participants' perception and reaction times. Participants engaged in systematic introspection, reporting their sensations, thoughts, and feelings associated with each stimulus. This process provided invaluable insight into the intricate processes underlying perception. Through data analysis from these experiments, Wundt sought to uncover the basic structures of consciousness, such as sensory perception thresholds and the relationship between stimulus characteristics and reaction times. These findings formed the basis of Wundt's theory of voluntarism, which posited that consciousness is an active process shaped by individual intentions and goals. While structuralism faced criticism for its reliance on subjective introspection, Wundt's experiments exemplified a systematic and rigorous approach to understanding the complexities of the mind. Despite its limitations, structuralism laid the groundwork for modern psychology by emphasizing the scientific study of consciousness and paving the way for future developments in psychological research methodologies. Functionalism, a prominent school of thought in psychology, emphasized the adaptive functions and practical significance of mental processes. Mary Whiton Calkins, a psychologist known for her work on memory, exemplified functionalist principles through her research endeavors. Calkins focused on exploring the functional aspects of memory, investigating how individuals utilize their memory systems to tackle everyday challenges and tasks. One of her significant contributions was the development of the paired associate technique, a method aimed at studying the associations between stimuli and responses in memory. In her experiments, Calkins presented participants with pairs of unrelated words or images, tasking them with memorizing the associations between them. She then tested their ability to recall the paired associates under various conditions, such as altering presentation formats or adjusting time intervals between learning and recall. Through her research, Calkins aimed to delve into not only the fundamental workings of memory, but also its practical applications in real-life contexts. By examining the strategies individuals employ to enhance memory performance and the factors influencing memory retention, Calkins provided valuable insights into the adaptive functions of memory in facilitating learning, problem-solving, and decision-making. Calkins' work epitomized the functionalist approach, which sought to understand mental processes in terms of their adaptive functions and relevance to everyday life. Her research contributed significantly to our understanding of memory as a dynamic system that serves the practical needs of individuals, aligning with the broader emphasis of functionalism on studying psychology within the context of real-world behaviors and experiences. Psychoanalysis, a pioneering psychological approach developed by Sigmund Freud and his colleagues, delves into the unconscious mind to understand the root causes of psychological symptoms and behaviors. A striking example of psychoanalytic practice is found in Freud and Joseph Breuer's renowned case study of Anna O., whose real identity was Bertha Pappenheim. Anna O. presented with a myriad of symptoms, including paralysis, hallucinations, and disturbances in speech and vision. Employing the psychoanalytic method, Freud and Breuer embarked on a journey with Anna O. to uncover the hidden psychological processes underlying her symptoms. They unearthed repressed memories and emotions stemming from traumatic experiences in her past, notably her caretaking role for her sick father, which led to the suppression of resentment and anger. Central to Anna O.'s treatment was the technique of free association, allowing her to express thoughts and emotions without inhibition. Through this process, Anna O. revealed unconscious conflicts and desires contributing to her symptoms. Additionally, Freud and Brewer analyzed her dreams, unveiling latent wishes and fears that illuminated her psychological struggles. The case of Anna O. serves as a paradigmatic illustration of psychoanalysis, highlighting its focus on unconscious processes and the significant impact of early life experiences on personality development. By delving into Anna O.'s psyche and bringing repressed memories and emotions into consciousness, Freud and Brewer facilitated psychological healing and symptom relief. While psychoanalysis has faced criticism for its lack of empirical evidence, the treatment of Anna O. underscored the efficacy of psychoanalytic techniques in addressing psychological disorders. This case study not only advanced psychoanalytic theory, but also left a profound legacy in the realm of therapy, shaping the course of psychology and influencing therapeutic practices for decades to come. Behaviorism, a foundational perspective in psychology, emphasizes the study of observable behaviors and the influence of environmental stimuli on behavior. One of the most famous experiments demonstrating behaviorist principles is the Little Albert experiment conducted by John B. Watson and Rosalie Rayner in 1920. In this landmark experiment, Watson and Rayner sought to illustrate classical conditioning by inducing a fear response in a young boy named Albert. Initially, Albert showed no fear towards various stimuli, including a white rat, a rabbit, a dog, and other furry objects. However, he did exhibit a strong fear response to loud noises, such as banging a hammer against a steel bar. The experiment unfolded with Watson and Rayner presenting Albert with the white rat while simultaneously striking a steel bar behind his head, eliciting a loud noise. Through repeated pairings of the rat with the loud noise, Albert began displaying fear responses, such as crying and attempting to crawl away upon encountering the rat alone, even without the presence of the loud noise. This experiment demonstrated how a neutral stimulus, the white rat, could become associated with a fear response through repeated pairings with an unconditioned stimulus, the loud noise. Albert had been conditioned to fear the rat, illustrating the principles of classical conditioning and highlighting the role of environmental stimuli in shaping behavior. The Little Albert experiment exemplifies the behaviorist approach of focusing on observable behavior and the principles of stimulus-response associations. It provided empirical evidence supporting the idea that behaviors, including emotional responses, can be learned and modified through environmental experiences. Despite ethical concerns surrounding the experiment, its findings significantly influenced the understanding of learning and behavior in psychology, paving the way for the development of behaviorist theories and therapies. Gestalt psychology, a school of thought emphasizing the organization and holistic nature of human perception, finds a compelling illustration in the perception of ambiguous figures, notably exemplified by the famous Necker cube. The Necker cube presents a two-dimensional drawing of a cube that can be interpreted in two distinct orientations, with the front facing either towards or away from the viewer. Despite its simplicity, observers frequently experience spontaneous reversals in perception, where the cube appears to flip between the two possible interpretations. Gestalt psychologists would interpret this phenomenon through the principle of figure-ground organization, which posits that perception is influenced by how elements are organized into meaningful wholes. In the case of the Necker cube, the ambiguous lines can be perceived as either the edges of a cube facing in one direction or another, leading to competing interpretations of the figure and ground. The perception of the Necker cube underscores the Gestalt principle that understanding perceptual experiences necessitates considering the overall organization and structure of the stimulus. Gestalt psychologists argue that the perception of the cube exemplifies the holistic nature of human cognition, where the mind organizes sensory input into coherent wholes based on principles of grouping and organization. This example demonstrates how Gestalt psychology offers insights into the processes underlying perception and the way humans make sense of the world around them. By studying ambiguous figures and perceptual phenomena, Gestalt psychologists illuminate the fundamental principles that govern how we perceive and interpret visual stimuli, thereby enriching our understanding of perception and cognition. Humanistic psychology, as a branch of psychology, emphasizes the inherent goodness and potential for growth in individuals, focusing on aspects such as self-actualization, personal agency, and empathy. An exemplary embodiment of these principles can be found in the remarkable life of Helen Keller, an American author, lecturer, and activist. Despite being deaf and blind from a young age, Keller's journey towards self-actualization serves as a compelling illustration of the humanistic belief in the resilience and capacity for personal growth in the face of adversity. Born in 1880 in Alabama, USA, Helen Keller's life took a dramatic turn when she lost her sight and hearing at just 19 months old due to illness. However, her story is not defined by her disabilities, but rather by her extraordinary determination, intellect, and indomitable spirit. With the guidance of her devoted teacher, Anne Sullivan, Keller learned to communicate through tactile sign language, setting the stage for her remarkable journey of self-discovery and accomplishment. Keller's pursuit of education and knowledge exemplifies the humanistic principle of self-actualization, the realization of one's full potential despite challenges and limitations. Through her relentless pursuit of learning, she defied societal expectations and became the first deaf-blind person to earn a Bachelor of Arts degree from Radcliffe College. Her subsequent career as an author, lecturer, and activist further underscored her commitment to personal growth and making a meaningful impact on the world. In addition to her academic and intellectual achievements, Keller's advocacy for causes such as women's suffrage, pacifism, and disability rights reflects her deep empathy and unwavering belief in the inherent worth and dignity of all individuals. Her relationship with Anne Sullivan serves as a poignant example of the transformative power of genuine human connection and empathy in facilitating personal growth and self-actualization. Ultimately, Helen Keller's life story serves as a timeless testament to the humanistic ideals of resilience, compassion, and the pursuit of personal fulfillment. Despite facing seemingly insurmountable challenges, Keller embraced life with courage and passion, inspiring generations to embrace their uniqueness, strive for personal growth, and make a positive difference in the world. Cognitive psychology delves into the intricate workings of the mind, examining processes such as memory, perception, and decision-making. One captivating area of study within cognitive psychology is memory processes, particularly illuminated by the groundbreaking research of Elizabeth Loftus on the misinformation effect. Through her pioneering experiments, Loftus unveiled how external influences can shape and distort our recollection of events, offering profound insights into the fallibility of memory. The misinformation effect, a hallmark phenomenon in cognitive psychology, elucidates how exposure to misleading information can profoundly alter one's memory of past events. Loftus's experiments, conducted alongside her colleagues, vividly illustrate this effect through carefully crafted scenarios and meticulous analysis of participant responses. In a seminal study, participants were shown a video depicting a car accident and subsequently asked questions about the event. Remarkably, participants exposed to leading questions suggesting the presence of a stop sign at the accident site were more inclined to falsely recall seeing the stop sign, despite its absence in the video footage. This striking demonstration underscores the malleability of memory and the susceptibility of recollection to external influences. Loftus's research serves as a compelling illustration of the interdisciplinary nature of cognitive psychology, bridging insights from psychology, neuroscience, and legal studies. Beyond theoretical advancements, her work holds practical implications, particularly in the realm of eyewitness testimony reliability and memory accuracy within legal contexts. By illuminating the mechanisms underlying memory distortion, Loftus's studies underscore the critical importance of cautious interpretation of eyewitness accounts and the potential for false memories to be inadvertently implanted through suggestive questioning or exposure to misleading information. Thus, her research not only enriches our understanding of human cognition, but also underscores the profound societal implications of cognitive psychology in addressing real-world issues. The biopsychosocial model offers a comprehensive framework for understanding health and illness, recognizing the intricate interplay between biological, psychological, and social factors in shaping human experiences. Nowhere is this holistic approach more evident than in the management of chronic pain conditions like fibromyalgia. Fibromyalgia, characterized by widespread pain, fatigue, and other debilitating symptoms, presents a complex clinical challenge that cannot be adequately addressed by considering biological factors alone. Indeed, the biopsychosocial model illuminates how biological, psychological, and social factors collectively influence the onset, progression, and management of this condition. From a biological perspective, fibromyalgia involves intricate physiological mechanisms, including abnormalities in neurotransmitter function, disruptions in pain processing pathways, and dysregulation of the autonomic nervous system. These biological underpinnings contribute to the hallmark symptoms of fibromyalgia and necessitate targeted interventions aimed at addressing underlying physiological dysfunctions. However, the experience of fibromyalgia extends beyond the realm of biology, encompassing profound psychological dimensions. Individuals living with fibromyalgia often contend with high levels of stress, anxiety, and depression, which can exacerbate pain perception and magnify the overall symptom burden. Psychological interventions, such as cognitive behavioral therapy, CBT, play a pivotal role in equipping individuals with coping strategies, alleviating distress, and fostering resilience in the face of chronic pain. Moreover, social factors exert a significant influence on the experience and management of fibromyalgia. Socioeconomic status, access to healthcare, social support networks, and cultural beliefs about pain and illness all shape individuals' experiences of fibromyalgia and their ability to cope effectively. Recognizing the importance of these social determinants underscores the need for comprehensive, patient-centered approaches that extend beyond the confines of traditional biomedical models. In the management of fibromyalgia, the biopsychosocial model underscores the imperative of addressing all three components, biological, psychological, and social, in an integrated and holistic manner. Multidisciplinary interventions that combine pharmacological treatments to target biological aspects of pain with psychological therapies and social support mechanisms offer a more nuanced and effective approach to managing this complex condition. By embracing the multifaceted nature of fibromyalgia within the biopsychosocial framework, healthcare providers can deliver more personalized, comprehensive care that acknowledges the diverse array of factors influencing patients' experiences and outcomes. In doing so, they not only alleviate suffering, but also empower individuals to reclaim agency over their health and well-being, embodying the essence of patient-centered care in the management of chronic pain conditions. Evolutionary psychology provides a compelling lens through which to examine the intricate dynamics of human behavior, shedding light on the adaptive functions of traits and behaviors shaped by millennia of natural selection. Nowhere is this more evident than in the study of parental investment theory, which offers profound insights into the evolutionary origins of parenting behaviors and strategies. Proposed by Robert Trivers in 1972, parental investment theory posits that the amount of time, energy, and resources parents invest in their offspring is influenced by the potential reproductive benefits and costs associated with raising children. Drawing upon principles of evolutionary biology, this theory underscores the notion that parenting behaviors have evolved to maximize reproductive success, with individuals adjusting their investment strategies in response to various environmental and social factors. One of the key tenets of parental investment theory is the recognition of asymmetries in parental investment between males and females, rooted in differences in reproductive biology and the differential costs associated with reproduction. Mothers, who bear the physiological burdens of pregnancy and lactation, typically invest more heavily in offspring compared to fathers. This biological asymmetry underscores the adaptive nature of parental behaviors, shaped by the imperative to ensure offspring survival and reproductive success. Moreover, evolutionary psychologists posit that parenting behaviors, such as nurturing, protecting, and providing for offspring, are adaptive responses honed by natural selection. From heightened vigilance to protective instincts, these behaviors serve to enhance offspring survival and increase the likelihood of passing on parental genes to future generations. Furthermore, parental investment theory predicts variability in parenting strategies across species and cultures, reflecting adaptations to diverse ecological and social conditions. In species where parental care is essential for offspring survival, both parents may contribute equally to offspring rearing, while in species with different mating systems, parental investment may vary significantly between males and females. By applying evolutionary principles to the study of parenting behaviors, evolutionary psychologists offer valuable insights into the universality of certain parental instincts across human cultures and animal species. This approach not only elucidates the adaptive functions of parenting strategies, but also underscores the complex interplay between biology, behavior, and reproductive success in shaping parental behaviors throughout evolutionary history. Social cognitive theory offers a nuanced perspective on how individuals learn and enact behavior change, emphasizing the interplay between cognitive, social, and environmental factors. Nowhere is the application of this theory more evident than in the realm of health behavior change interventions, particularly within smoking cessation programs. According to social cognitive theory, individuals acquire new behaviors not only through direct experience but also through observation of others and the outcomes of their actions. In the context of smoking cessation, this theory suggests that individuals can learn and be motivated to quit by observing others who have successfully overcome their smoking addiction, thus enhancing their self-efficacy and determination to initiate behavior change. Smoking cessation programs often leverage this aspect of social cognitive theory by incorporating testimonials or success stories from former smokers who have triumphantly quit the habit. These narratives serve as powerful models for individuals striving to quit smoking, offering not only inspiration, but also practical strategies and coping mechanisms. By witnessing others' successes, individuals may bolster their confidence in their own ability to quit and navigate potential obstacles along the way. Furthermore, social cognitive theory underscores the role of outcome expectancies in driving behavior change. In the context of smoking cessation, individuals weigh the anticipated benefits of quitting against the perceived costs associated with continued smoking. Interventions grounded in this theory strive to shift individuals' outcome expectancies towards the positive outcomes linked with smoking cessation, such as improved health, financial savings, and social acceptance, while addressing potential barriers like withdrawal symptoms and social pressures. By enhancing self-efficacy beliefs and reshaping outcome expectancies, smoking cessation interventions based on social cognitive theory aim to empower individuals with the confidence, motivation, and skills necessary to embark on and sustain the journey towards quitting smoking. This holistic approach addresses the cognitive, social, and environmental influences that underpin smoking behavior, ultimately fostering lasting behavior change and promoting overall health and well-being. In summary, social cognitive theory offers a robust framework for understanding and facilitating health behavior change, particularly in the context of smoking cessation. By harnessing the principles of observation, self-efficacy enhancement, and outcome expectancy manipulation, healthcare professionals can design effective interventions that empower individuals to take control of their health and break free from the grip of tobacco addiction. Attachment theory offers profound insights into the enduring influence of early attachment experiences on adult romantic relationships, illuminating the intricate interplay between past and present in shaping individuals' relationship dynamics. Grounded in the pioneering work of John Bowlby and Mary Ainsworth, attachment theory posits that the quality of early attachments with caregivers profoundly shapes individuals' internal working models of relationships, influencing their beliefs, expectations, and behaviors in adulthood. Central to attachment theory is the concept of secure attachment, characterized by feelings of trust, security, and comfort in interpersonal relationships. Individuals who experience secure attachments in childhood typically develop positive working models of themselves and others, fostering greater intimacy, communication, and relationship satisfaction in adult romantic partnerships. Conversely, insecure attachment styles, stemming from early experiences of neglect, inconsistency, or trauma, can give rise to maladaptive relationship patterns in adulthood. Individuals with insecure avoidant attachment styles may struggle with emotional closeness and intimacy, while those with insecure resistant attachment styles may exhibit clinginess, anxiety, and fear of abandonment within romantic relationships. Research corroborates the enduring influence of early attachment experiences on adult attachment styles, with individuals often mirroring their childhood attachment patterns in their romantic relationships. Understanding these dynamics provides valuable insights into variations in relationship satisfaction, conflict resolution, and emotional intimacy among couples. Furthermore, attachment theory informs therapeutic interventions aimed at improving adult romantic relationships by addressing underlying attachment-related issues. Relationship counselors may work with couples to identify and understand their attachment styles, explore the impact of early attachment experiences on current relationship dynamics, and develop strategies to promote greater security, trust, and intimacy. By recognizing the profound impact of early attachment experiences on adult romantic relationships, attachment theory offers a powerful framework for understanding the complexities of human connection and fostering healthier, more fulfilling partnerships. Through a nuanced understanding of attachment-related dynamics, individuals and couples can navigate the challenges of intimacy, communication, and trust, ultimately cultivating relationships that are characterized by resilience, understanding, and love. Ecological systems theory offers a comprehensive framework for understanding the intricate interplay between various environmental factors and their impact on child development. Rooted in the seminal work of Urie Bronfenbrenner, this theory posits that children's development is shaped by a complex network of interconnected systems, ranging from immediate family environments to broader cultural contexts. Consider a child growing up in a typical urban neighborhood. Ecological systems theory illuminates how the child's development is influenced by multiple layers of environmental systems, each exerting unique and interconnected effects. 1. Microsystem. At the heart of the child's ecological environment lies the microsystem, encompassing the immediate settings in which the child directly interacts. This includes the family, school, peer group, and neighborhood. Within the family microsystem, the quality of parent-child relationships, parenting styles, and family dynamics profoundly impact the child's socio-emotional and cognitive development. Similarly, interactions within the school environment and peer group contribute to academic achievement, social skills, and peer relationships. The neighborhood environment, including access to safe recreational spaces and community resources, shapes opportunities for play, socialization, and exploration. 2. Mesosystem. The mesosystem reflects the interconnections and interactions between different microsystems. For instance, the collaboration between family and school environments significantly influences the child's educational experiences and outcomes. Positive interactions, such as effective communication between parents and teachers, support the child's academic success and socio-emotional well-being. 3. Exosystem. Beyond immediate environments, the exosystem encompasses external settings that indirectly impact the child's development. This includes societal institutions, cultural norms, and public policies. Access to healthcare, early childhood education, and social support networks can enhance the child's health, learning, and socioeconomic opportunities. Conversely, exposure to community violence, poverty, and discrimination may pose risks to development. 4. Macrosystem. At the broadest level, the macrosystem encompasses cultural, economic, and political contexts. Cultural values, beliefs, and societal norms shape parenting practices, educational expectations, and child-rearing ideologies. Economic policies and social inequalities influence access to resources and opportunities for children and families. Ecological systems theory underscores the need to consider the interactions between these various environmental systems to understand child development fully. It emphasizes the importance of addressing environmental factors at multiple levels to support positive outcomes for children and families. Interventions informed by this theory may involve strengthening family support networks, improving access to education and healthcare, promoting community development initiatives, and advocating for policies that address social and economic disparities. Through a holistic understanding of the ecological environment, interventions can effectively support the healthy development and well-being of children. Cultural psychology offers a fascinating lens through which to explore the rich tapestry of human emotions, unveiling the profound ways in which cultural contexts shape the expression and regulation of emotions. Nowhere is this more evident than in the study of emotional expression and display rules across different cultures, where cultural norms, values, and practices exert a profound influence on how emotions are experienced and expressed. Emotional expression, a universal aspect of human behavior, manifests itself in myriad forms across diverse cultural landscapes. Cultural psychologists have delved into the intricacies of these cultural variations, seeking to unravel the underlying norms and values that govern emotional processes. For instance, in East Asian cultures, there may be a pronounced emphasis on emotional restraint and suppression, rooted in values of harmony, social cohesion, and emotional self-control. Individuals in these cultures may strive to maintain composure and avoid outward displays of emotion, particularly negative emotions like anger or sadness. In contrast, Western cultures often prioritize individualistic values and the authentic expression of emotions as a means of self-expression. Here, individuals may feel more comfortable openly expressing a range of emotions, both positive and negative, as a way of communicating their inner feelings and experiences. These cultural differences in emotional expression are further nuanced by display rules, social norms dictating when, where, and how emotions should be expressed. In collectivist cultures, for example, individuals may adhere to display rules aimed at preserving harmony and avoiding conflict, even if it means suppressing or masking their true emotions in social interactions. Cultural psychologists employ diverse methodologies, from cross-cultural surveys to observational studies and experiments, to uncover these intricate cultural variations in emotional expression. By comparing different cultural groups, researchers illuminate patterns of emotional expression unique to specific cultural contexts, shedding light on the underlying values and norms shaping these patterns. Understanding cultural variations in emotional expression holds not only theoretical significance, but also practical implications for domains such as mental health and interpersonal communication. Mental health professionals, for instance, must navigate cultural differences in emotional expression sensitively, considering how cultural norms may influence clients' experiences and preferences in therapy. In sum, the study of emotional expression across cultures serves as a compelling example of cultural psychology's exploration of the interplay between culture and human psychology. By recognizing and embracing cultural diversity in emotional processes, cultural psychology deepens our understanding of human nature and fosters greater cultural competence in psychological research and practice. Positive psychology represents a paradigm shift in psychology, emphasizing the study of human strengths, virtues, and flourishing rather than solely focusing on pathology and dysfunction. Within this framework, gratitude interventions stand out as a powerful tool for promoting well-being and life satisfaction, exemplifying the principles of positive psychology in action. Gratitude interventions, central to positive psychology, are designed to cultivate positive emotions and enhance subjective well-being by encouraging individuals to focus on and express gratitude for the positive aspects of their lives. These interventions encompass a variety of activities aimed at increasing awareness and appreciation of life's blessings. One common gratitude intervention involves keeping a gratitude journal, where individuals regularly record things they are thankful for each day. By consciously acknowledging and reflecting on the positive experiences and blessings in their lives, individuals cultivate a sense of appreciation and abundance, leading to increased well-being and life satisfaction. Another approach to gratitude interventions includes writing gratitude letters or notes to express thanks and appreciation to people who have positively impacted their lives. This practice not only strengthens social connections, but also fosters positive emotions and enhances overall life satisfaction. Research in positive psychology has demonstrated the numerous benefits of gratitude interventions for psychological well-being. Individuals who engage in gratitude practices regularly report higher levels of happiness, optimism, and life satisfaction, along with reduced levels of depression and stress. Furthermore, the effects of gratitude interventions extend beyond individual well-being to interpersonal relationships and social dynamics. Expressing gratitude towards others strengthens social bonds, promotes feelings of closeness and connection, and contributes to a supportive and positive social environment. Gratitude interventions have found application in diverse settings, including schools, workplaces, healthcare settings, and therapy. Educators may incorporate gratitude activities into classroom routines to foster a positive and supportive learning environment, while organizations implement gratitude practices as part of employee wellness programs to enhance job satisfaction and morale. In essence, gratitude interventions exemplify the core tenets of positive psychology by focusing on individual strengths, promoting positive emotions, and fostering a sense of appreciation and well-being. By cultivating gratitude, individuals can adopt a more positive outlook on life, enhance their relationships, and ultimately elevate their overall quality of life. In the dynamic landscape of 21st-century neuroscience, the advent of functional magnetic resonance imaging, fMRI, stands as a transformative milestone, offering unprecedented insights into the intricate workings of the human brain. One compelling application of fMRI technology lies in the study of decision-making processes, where researchers harness its power to unravel the neural underpinnings of choice and behavior. Functional MRI, fMRI, has revolutionized our ability to probe the neural correlates of decision-making by enabling non-invasive observation of changes in blood flow and oxygenation levels within the brain, indicative of neural activity. This cutting-edge technology has opened a window into the neural dynamics that govern various cognitive functions, offering researchers a powerful tool for investigating the complexities of decision-making. In studies of decision-making, participants are presented with scenarios or tasks that necessitate choices between different options. Utilizing fMRI, researchers can monitor brain activity in real time as participants deliberate and make decisions, unveiling the neural signatures associated with different stages of the decision-making process. For instance, investigations into economic decision-making may involve presenting participants with choices involving monetary rewards or losses. By analyzing fMRI data collected during these tasks, researchers discern patterns of brain activity linked to key facets of decision-making, such as evaluating options, assessing potential outcomes, and arriving at final choices. Through fMRI studies, researchers have illuminated the intricate neural circuitry that underlies decision-making, revealing complex interactions between multiple brain regions. Regions such as the prefrontal cortex, anterior cingulate cortex, insula, and striatum have emerged as pivotal players in decision-making processes, contributing to functions such as risk assessment, outcome monitoring, and emotional regulation. Moreover, fMRI studies have unveiled how factors like uncertainty, ambiguity, and social influence shape decision-making processes. By manipulating experimental conditions and scrutinizing corresponding changes in brain activity, researchers gain profound insights into the cognitive and neural mechanisms that govern decision-making under diverse circumstances. The revelations gleaned from fMRI studies of decision-making hold broad-reaching implications, spanning fields such as economics, marketing, and public policy. By elucidating the neural mechanisms that underlie decision-making, neuroscience research using fMRI has the potential to inform interventions aimed at enhancing decision-making prowess and optimizing outcomes across various domains of human endeavor. Transpersonal psychology, a distinctive paradigm that emerged in the late 20th century, offers a profound departure from traditional psychological perspectives by acknowledging and delving into the spiritual dimensions of human existence. Unlike conventional approaches that primarily address symptoms of psychological distress, transpersonal psychology embraces the exploration of profound questions related to meaning, purpose, and interconnectedness. Here, we illustrate the application of transpersonal psychology through a hypothetical therapeutic scenario. Imagine an individual who seeks therapy burdened by feelings of existential emptiness and a pervasive sense of aimlessness in life. While conventional therapeutic modalities might focus on alleviating symptoms of depression or anxiety, transpersonal psychology offers an alternative path. In transpersonal therapy, the therapist adopts a holistic approach, integrating psychological principles with spiritual practices to facilitate profound self-awareness and existential exploration. Techniques such as mindfulness meditation or breathwork may be employed to guide the individual into deeper states of consciousness, where existential questions are confronted and spiritual insights are revealed. As therapy progresses, the individual embarks on a transformative journey of spiritual awakening and self-discovery. Through this process, they undergo a fundamental shift in perspective, transcending narrow notions of self to embrace a broader awareness of interconnectedness with the cosmos. This newfound understanding fosters a profound sense of purpose and meaning, leading to enhanced psychological well-being and a deeper sense of fulfillment in life. From the transpersonal perspective, the individual's struggles are not merely viewed as symptoms of psychopathology, but as catalysts for spiritual growth and personal evolution. By embracing the existential dimensions of human existence, transpersonal therapy offers a holistic framework for healing that transcends conventional boundaries. This hypothetical example exemplifies how transpersonal psychology applies its principles and techniques in therapeutic settings to foster personal growth, spiritual development, and existential exploration. By integrating psychological insights with spiritual wisdom, transpersonal psychology offers individuals a transformative journey towards self-realization and a deeper understanding of their place in the universe.